It's a pleasure to welcome you to this edition of NAFDAC and Your Health, where we bring you the activities of NAFDAC, the agency that has the mandate to safeguard the health of the nation. I am your regular host, Amanda Ugo.
This edition of NAFDAC and Your Health begins with the visit of the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, to NAFDAC's Central Drug Control Laboratory, Yaba, Lagos, after the World Health Organization's announcement of the laboratory's pre-qualification status. And in the second segment, we'll be looking at NAFDAC's efforts at encouraging the development of indigenous manufacturing industries. The mandate of NAFDAC to safeguard the health of Nigerians is one that is important to the Ministry of Health, which is the ministry under which NAFDAC as an agency is. This is why it is the responsibility of the ministry to strive to ensure that NAFDAC as a regulatory agency under it achieves breakthroughs in its efforts to ensure the well-being of the Nigerian people. One of the breakthroughs of NAFDAC, which also gives credibility to the Ministry of Health, is the World Health Organization's announcement of the pre-qualification status of NAFDAC's Central Drug Control Laboratory, Yaba, which was made known by the Director General of NAFDAC, Professor Mojisola Adeyeye, recently.
NAFDAC is delighted to announce a momentous achievement for the Central Drug Control Laboratory, CDCL, in Yaba, Lagos. The World Health Organization has officially granted the WHO pre-qualification status to the laboratory, signifying a milestone in its dedication to ensuring the safety and quality of pharmaceutical products. This was communicated to us through a mail received from the WHO inspection team in September. We waited this long because we wanted the WHO team to also meet with our Honorable Minister, the Coordinating Minister of Health and Social Welfare, Professor Ali Pate. The success was finally published on the WHO website last week, and the website address through which the public can cite and reference this was shared with us for dissemination to the general public, or will be shared with us for dissemination to the general public. You can access the information on the pre-qualification procedure as well as the list of pre-qualified quality control laboratories on the pre-qualification unit, and the website URL is included. NAFDAC is Nigeria's regulatory body responsible for ensuring safety and quality of food, drugs, cosmetics, medical devices, in vitro diagnostics, and other related products. NAFDAC's mission is to safeguard public health by ensuring that only safe and wholesome products are made available to the Nigerian populace. And if the product is not wholesome, we will go after those that are distributing such and make sure that they will never do it again through sanctions. This achievement is a huge landmark for the agency and Nigeria. Very few laboratories in the world have the apex status of the WHO pre-qualification.
It is in appreciation of this feat achieved by the Director General of NAFDAC, the management team and the entire staff of NAFDAC, and to see the state of the laboratory himself, that the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, paid a courtesy visit to NAFDAC's Central Drug Control Laboratory recently. The minister was conducted round the various specialized drug laboratories at the Yaba Laboratory Complex by the Director General of NAFDAC, Professor Mojisola Adeyeye, and the Director of Drug Laboratory, Mr. Victor Abiola.
All the samples.
So what stage do they come to?
They come at the point of registration or at the point of being imported. We take samples. Dr. Adeboye takes, the department takes samples at the port and bring.
And once you register them?
Once we register them, Of course, they go to the market. But before they come into the country, they are being imported.
Each time?
Each time.
So if you're registered?
Yes.
Each time before you get into the market, you get sample and tested?
We test, we use risk-based categorization or risk-based sampling. Meaning, if we have 1,000 samples, we cannot test 1,000 samples.
Yeah.
If it is sterile product, we have to test. If it is a product that will be applied to the membrane directly, we will test. But if it's product that we know is very stable and whatnot, we use scientific method to determine that. So we take some of those samples to here to test.
And then the locally manufactured products, how do you sample them?
The locally manufactured products, when we go for good manufacturing practice inspection, we get samples from wherever.
How frequent do they get them? How frequent do you?
It depends on the GMP compliance of the company. There are some companies we do every 6 months. There are some companies every year. Another, the best, or the low risk, about 2 years.
Yes. And for the devices?
Yes.
How do you, they don't come here or do they come here?
They go to the vaccine medical devices lab downstairs. And we have, different tests for the medical devices. All this characterization has to be done. So a company brings in a product and says the dissolution is 80% in 30 minutes. For the bioequivalence, you have to test it to be sure that what the manufacturer says or claims is right. So you will see something like that in the bioequivalence, despite the fact that it's supposed to be in vivo, meaning blood samples, urine samples, and so on. So these are the dissolution apparatuses to characterize the in vitro properties, the percentage of the active ingredients in the product. So what you will do for a tablet, you extract, you will have known the properties of the polarity of the solvent, which one is going to go into polar solvent or non-polar solvent. Once you get that straight, then the mobile phases have to be optimized. The medium that is going to carry the medicines, and then inject into the column, and then the rest is history.
There are different detectors. This product now, they release the analysis. They are first of all going to, when the analysis is to comment, they start with the physical appearance. They want to see how does it look, the labels and everything. Is it okay? Does it meet our label requirements and the date markings and everything? We check up. It's okay. Then we bring the product out. In the description, is that how what it is? It's in the bottle, brown bottle, good. Then we bring it out. We open, look at the color and the texture. It meets the specification in the certificate of analysis. Then we can start analysis. So the analysis now will be done based on the method prescribed in the compendium. We use United States Pharmacopoeia, British Pharmacopoeia, and National Pharmacopoeia. For whichever one the manufacturer recommend, we follow that analysis. If it's USP, then we now look at what does USP want us to do. Okay, well, we can do fill volume. If I fill it, what's the volume I net in it? If I put water and reconstitute it, what is the weight per mil? The weight per mil of that substance. Now, from there, we now progress to other analysis like the assay and perhaps that simple instrument there is used to determine the water content.
The minister also took time to listen to the process of receiving samples for testing in the drug laboratory.
How do you track?
Okay.
So just walk with. Bring the seat for that.
Now,
One seat for
when
madam.
any directory is bringing a sample, we also have these links that limited access. They give in whatever they are bringing in from their end, and they export it to our mill here. So once it comes, we check the mill if it has been imported, it has been sent to the mill. So once it's been sent to the mill, we open it. Before we import it into limbs, we check the, so that's why you see the tray and the basket there. The shelf, they display it, which check for labeling, if it's badge number, if the seal is broken, if anything is broken, we don't see, just like what the WHO guideline says.
So we reject that, and we also do a reject for them and print out for them where they sign and receive. So when that is done and we're okay, we take replicate samples in basket, then we pick one, then we import what they have keyed in into LIMS. So once they key, when they do that, we come to this place, and this, you see that says test request submissions. We have imported into LIMS. I'll give you an example of one. Yes. So for example, let's assume this is part of what they have brought. So what I do is I double click on this.
You see all the
Yeah, I see all what they have keyed in. So I check if there are errors, because sometimes they make mistake in description, the dosage form, or the sample category. So we do that correction here, and checking everything with this against the sample, the physical sample that is brought, the batch number, the date markings, and the documents they bring. We also tick that because the barcode prints automatically according to the quantity of sample and the documents they bring. We paste that number. For example, you can see this a number, a NAFDAC number on it, so we paste on it, and the samples too. So when we have done that, we submit, and we print something like this. We accept. So for the ones that we are rejecting, if it's the seal is broken, or there's the labeling is bad, we reject. It also prints something like this for us. So, and the customer will sign, and the person who processed it will sign, and I as a supervisor will sign. So from this, it's taken for allocation, and it comes back here where we capture the image into the system. Maybe I give you an example of one that we capture. This is limited password. Let me sign on my own password, because in LIMS you are given access, the control to your work. So as the head, I have more access than the staff.
Are you able to sort of track the processing to sort of
Yes.
see how long each?
Yes,
takes?
I am. Like my director said, every 11, any work that is not completed, based on the timeline on our SOP, it drops in my mail, and I follow that up with any of the officers. So let me see, for example, give me a name of a sample. Make for me. Make for me, yeah. That's easy. Make for me. So you can see that's the image. We capture that. That's the once it has been allocated, we capture it here, and this barcode prints the number. This is the camera. We have one here too. So it's attached. We just capture it.
After the inspection, Professor Ali Pate expressed great delight at what he saw at the laboratory complex.
This lab has been pre-qualified by WHO, which means that it has reached a certain standard of quality, and that is good. And we're very glad that NAFDAC has strengthened its ability to regulate the pharmaceutical sector and the food and other important commodities that Nigerians use on a daily basis. In terms of our agenda for protecting the health of Nigerians, this is very, very critical function that NAFDAC is fulfilling as a regulator within the sector. And we are very pleased with what I've seen and the staff that I've met here. And of course the Director General, who is also doing her best to improve the standard of healthcare regulation for pharmaceuticals, for other medical products in Nigeria. It will be important for the health of Nigerians, but also for the agenda that we have to unlock the healthcare value chain, to produce things that we consume. If we have a good regulator, then the industry would learn to improve the standards to which they produce things, and they will be competitive.
The program has been NAFDAC and Your Health. Please do not go away. We'll be back shortly. Welcome back. Let's go on to the next feature on this edition of the program. The current Director General of NAFDAC, Professor Mojisola Adeyeye, has since the inception of her headship of the regulatory agency striven to make Nigeria self-sufficient in terms of food and drug production. In addition to this, she also has the vision to entrench food and drug security in the country. This has seen her putting in place policies and adopting strategies. Part of this is the 5+5 policy, and today, to a great extent, the Director General's dream has come to fruition and exponential progress continues to be made in this regard by the day, particularly on drug security.
What we are seeing now is the thought and efforts of NAFDAC that are now yielding fruit, and it's the beginning. Because we were strengthening ourselves and strengthening the industry, we now have the first company in the whole of West Africa and Central Africa to have a pre-qualified product.
The determination of Professor Mojisola Adeyeye led NAFDAC management team to further improve on local drug manufacturing as a step towards enhancing drug security and making Nigeria self-sufficient in terms of drug has seen the agency collaborating with relevant stakeholders and harnessing resources. It is one of such efforts that brought about the recently held 3-day workshop on local manufacturing of active pharmaceutical ingredients. The workshop, organized by NAFDAC and sponsored by Bill and Melinda Gates Foundation, was held at Marriott Hotel, Ikeja, Lagos State.
We have grown together, both the manufacturers and the regulators, and we are still growing because our goal is to make sure that the products we make in Nigeria can be traded globally, and you cannot trade what is not of quality. You cannot trade when you don't have international standards built into the development. So that is why we're here today.
The Director General went on to talk about the significance of APIs and excipients and how the ink of these ingredients could wreak havoc globally.
Active pharmaceutical ingredients and excipients. We may think that excipients are innocuous, are just non-active ingredients. No. They are as important as the active ingredients. And they may even kill faster than the medicines, because most formulations have up to 80–90% of non-active ingredients or excipients in the formulation. And we are witnesses to the horrors that are happening all over the world with the so-called children's syrup that have killed hundreds of children. In Gambia, 66, in Cameroon, about 22, Uzbekistan, maybe over 200, Indonesia, the same, and it's still counting. Diethylene glycol is a non-active ingredient. I will not call it excipient because it's not meant to be part of a formulation, any formulation actually. So that is why we are here to sensitize us.
Present at the workshop were the Coordinating Minister of Health, Professor Ali Mohammed Pate, who was ably represented by pharmacist Oderinde, the Chairman, House Committee on Food and Drugs, Federal House of Representatives, Honorable Mrs. Regina Akume, ably represented by Right Honorable Udu Obiajulo, the Special Assistant to the President on Health, Hajia Salma Anas, scholars from the academia, and experts on APIs. Delivering his keynote address through his representative, the Coordinating Minister of Health, Professor Ali Pate, stated that his objectives aligns with the objectives of NAFDAC.
First, let me congratulate the DG, Professor Christiana Mojisola Adeyeye, and the entire staff of the National Agency for Food and Drug Administration and Control, NAFDAC, for always being a beacon of hope that our beloved country can get things right and match the global community in attaining global best practices, especially when it comes to the provision of quality healthcare services to the people. I believe by now you are well acquainted with my priority objectives, which are health security, where we hope to ensure that in disease outbreaks or epidemics, Nigeria is prepared and able to effectively respond and minimize humanitarian crises. Medical industrialization, which is the value chain of the sector, given that 70% of the nation's pharmaceuticals are imported from countries that are just like Nigeria, while Nigeria does not produce any. Improvement of population health outcomes, so that diseases such as diphtheria, measles, vaccine-preventable diseases, and maternal and child health will be reduced to the barest minimum. Improve the quality of governance and leadership of hospitals. Therefore, it is clear from the foregoing that this workshop, which is well aligned with my priority objectives, could not have come at a better time. Under my watch at the helm of affairs in the ministry, you are guaranteed maximum support to facilitate the effective and efficient regulation and control of the manufacture, importation, exportation, distribution, advertisement, sale and use of food, drugs, cosmetics, chemicals, detergents, medical devices, and packaged water, all collectively known as regulated products. The ministry will also be committed to ensuring that NAFDAC becomes a regulatory institution that has capacity to protect and promote the public health.
The minister also added that Ministry of Health is ready to support NAFDAC to ensure the agency attains maturity level 4. This is where we draw the curtains on today's episode of NAFDAC and Your Health. We'll be back again next week with more updates on the frantic efforts of NAFDAC aimed at safeguarding the health of the nation. You can also help NAFDAC keep our society safe by supplying us with any information on activities that could mar the efforts of NAFDAC at safeguarding the health of the nation. If you have such information, please reach out to us.
You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded.
Remember, it is criminal to import, produce, distribute, market, or sell unwholesome food products, counterfeit medical equipment, drugs, or chemicals. Don't hesitate to report these nefarious acts to NAFDAC to assist in safeguarding the health of the nation. Till we meet again next week, stay safe.